So, chapter fluid and electrolyte balance. First said, what is electrolyte and what are the measurement to measure electrolyte? So, electrolyte N is a substance that on dissolved in a solution or ions that is some of its molecules split or dissociate into electrically charged atoms or ions. Measurement, the metric systems is used to measure volume of fluid. Sometimes we use liter or meter. The unit of measure that is expresses the combining activities of an electrolyte is the milliequivalent. So milliequivalent liter or milliliter are the unit to measure electrolytes. Some concept of fluid and electrolyte balance and properties of electrolyte and their components. So you see the keyword atoms, molecules, ions, cation, and anions. In a short discussion, I want to tell you sodium, potassium, calcium, magnesium, and chloride. So they are electrolytes, right? Sodium, potassium, calcium, magnesium, we said positive. But chloride is a negative. All of them are electrolyte because of the chloride contain the outer layer negatively charged, and this is an ion. But sodium, potassium, calcium, magnesium, they contain the positive charge, it is cation. So anion and cation, positive or negative, all are ions. So ions is an atoms that carry electrical charge because it has a gain or loss electrons. So ions basically atoms. And atoms is the smallest part of elements that still has properties of elements. When some atoms put together, it is called molecules. So a molecule is two or more atoms that combine to form a substance. What next? The concept of fluid and electrolyte balance. So body fluid compartment. So body fluid compartment, we divide it into two categories: intracellular fluid and extracellular. Intracellular is 65%, but extracellular outside the cell 35%. Extracellular fluid again subdivided into interstitial, plasma, lymph, and transcellular fluid. So fluid in which the body compartment contains electrolytes. Each compartment has a particular composition of electrolytes that differ from that of other compartments. To function normally, the body cell must have fluid and electrolyte in the right compartment and in the right amount for hemostasis. Whenever an electrolyte moves out of the cell, then another electrolyte moves in to take its place. This is the way always maintain homeostasis in the body. The number of cation and anion must be same for homeostasis. So homeostasis, it does not mean only cation or anion. Homeostasis also applicable for blood loss or fluid loss. So because of homeostasis maintained, we are okay. And because of homeostasis, our body always be functioning. Because it is a tendency towards a relatively stable equilibrium between interdependent elements, especially what is maintaining by physiological process in our body. Compartments are separated by semi-permeable membrane. Every compartment separated by a membrane is called semi-permeable. They allow to movement very small solute. Intracellular compartment refer to all fluid inside the cell, and most body fluid are inside the cell. In this picture, we see this is the blood vessel, intravascular. Where is the red blood cell, platelet, white blood cell moving on? Fluid is here as well. Fluid in between two cells, fluid in between cell and blood vessel. So the fluid inside the cell we call intracellular. The fluid inside the blood vessel we call intravascular. The fluid in between two cells or outside the cell we call extracellular. And fluid in between cells and vascular system we call interstitial. So distribution of fluid by compartment, right? Now let me talk about extracellular compartment. Means outside the cell. So refer to all fluid outside cell. So it is extracellular. Includes interstitial fluid, which is the fluid between cells, sometimes called heart space. Interstitial or blood, lymph, bones, connective tissue, water, and transcellular. What is transcellular fluid? So we have a fluid in brain. It's called cerebrospinal fluid. Right? We have a fluid in our joints. It's called synovial fluid. We have a fluid in our eye, intraocular fluid. All of them together called transcellular. So interstitial fluid, other keyword is called third spacing fluid. Accumulation and sequestration of trapped interstitial fluid in an actual or potential body space as a result of disease or injuries. The fluid may be trapped in body space such as pericardium, pleura. So lungs is covered by pleura. If the fluid is accumulated in between lungs and pleura, if the fluid is accumulated heart and outer layer of the heart, or peritoneum, joint cavity, the bowel or abdomen, or within the soft tissue after trauma or burn. So gathering the data about intravascular fluid loss is difficult. It may not be reflected in weight change or intake or output records, and it may not become apparent until after the organ malfunction occurs. Now let me talk about edema. So what is edema? So edema means an excessive accumulation of the fluid in the interstitial space occur as a result of alteration of oncotic pressure, hydrostatic pressure, capillary permeability, and lymphatic obstruction. Right? Easy way to explain, edema is the swelling caused by excessive fluid trapped in body cavities or tissue. And keep in mind, edema can affect any part of our body, but more common in feet, abdomen, and face. So why edema occur? Because of imbalance or alteration of oncotic pressure. What is oncotic pressure? Pressure because of protein. So like liver can produce the protein, and protein has a pressure which is called oncotic pressure. Imagine a patient have a chronic liver disease, cirrhosis, carcinoma of the liver. Liver does not produce protein. Less protein, less oncotic pressure means alteration of the pressure, and edema develop, and it is called ascites. Hydrostatic pressure means the pressure because of water. Imagine kidney has an important role to maintain the equilibrium, right? But if kidney does not work, fluid accumulate and patient develop facial edema, capillary permeabilities, or lymphatic obstruction. Edema may be localized or generalized. If it is localized, result of the traumatic injury from accident or surgical, like local inflammatory process or burn. But generalized edema, also called anasarca, an excessive accumulation of fluid in the interstitial space throughout the body as a result of a condition such as cardiac, renal, and liver failure. So if liver doesn't work, if kidney problem, chronic kidney disease, or congestive heart failure, patient develop generalized edema. Now, let me talk about the body fluid. Body fluid provides transformation of nutrient in the cells and carry the waste product from the cell. Total body fluid amount of the amount about 60% total body weight in case of adult, right? So 80% is infant have a body fluid, is water. Now let me read it. Thus, infant and old adult are the high risk for the fluid related problems. Children have a greater proportion of body water than adult. An older adult has least proportion of the body water. NCLEX board asks a question. If diarrhea or vomiting, even burn patient, chance of loss of huge amount of fluid from the body, and patient undergo to the shock, hypovolemic shock, who are under the risk: children, infant, and old person. So, constituent of the body fluid. Body fluid consists of water and also dissolved substances, means electrolytes, sodium, potassium, calcium, magnesium. The large single fluid constituent of the body is a water. Infant or old adult need to be monitored closely for fluid imbalance. Very important. Now, how fluid is transported in the body? What are the different mechanisms? So, fluid can transmitted by diffusion, osmosis, or filtration. So fluid can transmit to the body through the diffusion or osmosis or filtration, right? And this type of movement depends on hydrostatic pressure or osmolality. It depends. What is diffusion? Or what is osmosis? Diffusion is a process where a solute may speed through a or move through a solution or solvent. Diffusion of a solute move the molecules from one area of higher concentration to an area of lower concentration. The other definition, diffusion occurs within the fluid compartment and from one compartment to another if barrier between the compartment is permeable to the diffusing substance. So this is the true solution. Concentration is here, high is here. Concentration is less this area. Then it is distributed all over and look like this. So diffusion means movement of particles. This is the movement. This is the particles movement to the lower concentration, this area. And like this. The overall effect is equalize the concentration throughout the medium. Osmosis here. So two liquids separated by semi-permeable membrane. Concentration less here, but concentration is more this portion. Then liquid or water is moved to high concentrate area. This is osmosis. So osmosis is the movement of solvent, means water, across the semi-permeable membrane from a diluted solution into the concentrated solution. Another one, filtration. So filtration is the movement of solute and solvent by hydrostatic pressure. How kidney work, right? This is the glomerulus. Where is the filtration occur? The movement is from one area of higher pressure to an area of lower pressure. So osmosis, diffusion, or filtration, the overall effect is to equalize concentration throughout the medium. It is occur because of hydrostatic pressure or osmolalities. Here I'm showing fluid volumes and osmolality imbalance. Normal, decrease the volumes and increase the volumes. So when decrease volumes, increase osmolalities. Increase volumes, decrease osmolalities. Movement of fluid. Cell membrane separate interstitial fluid from extravascular fluid. In this picture, this is intravascular and this is extravascular, and this is the cell membrane separated. This is the permeable membrane. Cell membrane are selectively permeable, or several forces affect the movement of water or solute through the wall of cell or capillaries. If the body loses more electrolyte than the fluid, as can happen with diarrhea, then the extracellular fluid will contain fewer electrolytes or less solute than the intracellular. Fluids and electrolyte must be kept in balance for health. When they remain out of balance, or death may occur. Now, talking about the different kind of solution, one is isotonic solution, other is the hypertonic solution, and hypotonic solution. Isotonic solution, when the solution on both sides of a selectively permeable membrane have established equilibrium or an equal in concentration. Isotonic solutions are isotonic to the human cell. Thus, very little osmosis occurs. So, the tonicity or concentration of dissolved particles is equal to intracellular fluid. Particularly, isotonic solution we use during dehydration or hypovolemic shock, when fluid volume deficit, we use the isotonic solution. Like a patient need blood transfusion, So during the blood transfusion, isotonic solution use a company. Hypertonic means a solution that has a higher concentration of solute than another less concentrated solution. So tonicity is greater than intracellular fluid, right? And hypotonic solution, we never give hypertonic fluid to the patient that are dehydrated, such as diabetic ketoacidosis. We never give hypertonic solution. And hypotonic means the tonicity or concentration of dissolved particles less than intracellular fluid. When a solute contains a lower concentration of salt or solute than another more concentrated solution, it is considered hypotonic. So when we use the hypotonic solution, hypotonic, basically water is moved into the cell, which causes the cell to swell up. We never give hypotonic solution to the patient with liver disease, with burn patient, or trauma patient. And next go fluid volume deficit and fluid volume excess or overload. So fluid volume deficit or fluid volume overload here. What are the effect occur? Cardiovascular, steady pulse, increase the pulse rate, decrease blood volume pressure, or flat neck and hand pains, diminished peripheral pulses, decreased central venous pressure, or dysrhythmias. So if anybody fluid volume go down, in cardiovascular change occur like this. Respiratory system increase the rate and depth of respiration, and patient develop shortness of breath. Neuromuscular, decrease the central nervous system activities, or fever, depending the amount of the fluid, or skeletal muscle weakness. So if anybody have a fluid volume excess, what happened? Fluid volume exceed, patient develop bounding pulse, or increase the pulse rate, elevated blood pressure because of fluid volume overload occur. Or elevated or distended neck vein, elevated central venous pressure. This it means both cases. Rhythm change, increased respiratory rate, shortness of breath, dyspnea, both cases. But fluid volume excess or overload, patient develop trickles inside the lungs, and you got it during post-condition. Alter the level of consciousness, patient develop headache, visual disturbance, skeletal muscle weakness, and paresthesia. What else? What next? So decrease the urine output because fluid is less in the body. Urine output will be less, right? Intragumentary dry skin, poor trigger, dry mouth. Because my patient is dehydrated. Gastro, decreased mortalities, diminished vowel sound, constipation, thirsty, and decreased body weight. Right? So nursing care is very important. Fluid volume deficit. We measure the body weight daily, provide fluid replacement, and we report healthcare provider if urine output less than 30 ml per hour. And also we help our patient to ambulation because this patient is easily fall. Fluid volume exceeds, increase the urine output if the kidney can compensate, decrease urine output if the kidney damage is the underlying cause. Or pitching edema developed, pale, cold skin, increase the motilities in the GI, diarrhea, increased body weight, liver enlargement, or ascites. As like fluid volume deficit, when we take care or nursing care fluid volume excess, we measure the body weight, but restrict fluid intake or sodium as prescribed. We admit oxygen and diuretics. Also prevent the skin breakdown, very important for fluid volume exceed patient. Here showing compare contrast laboratory findings. So it is easy to remember. In case of fluid volume deficit means fluid volume less in the body, dehydrated, everything go down. So fluid volume go down, but lab result increase serum osmolarities because solution increase, less water, increase hematocrit, volume less, corpuscle is more, increase blood urea nitrogen, BUN, less water, nitrogen product more, increase serum sodium level, increase urine specific gravity. Hyponatremia develop, increase sodium level. Whereas the fluid volume excess, overload, everything is decreased because more fluid, solute less, decrease hematocrit, decrease osmolality, hematocrit less, decrease BUN level, decrease serum sodium level, and decrease urine specific gravity, right? Decrease creatinine as well. Now, body fluid intake and output. Water entered the body through three sources. Oral ingestion means what we drink, water take with food, and water formed by oxidation process or oxidation of the food. Oxidation is when occur the food start metabolism of the food. So about 10 ml of water is released by metabolism of each 100 calorie of fat, carbohydrate, and protein. Body fluid output, input and output, very important. Water loss through the skin, it is called insensible loss, or the amount of the water loss by perspiration. It is varies according to the temperature of the environment. Average amount of loss by perspiration along 100 ml per day. Water lost from the lungs is called insensible loss and is lost through the expired air that is saturated with water vapor. Here showing fluid intake and fluid output. Total amount around 3000 ml or 3 liters. And same amount, it would be approximately same, 3000 ml or 3 liter. Input and output should be equal. So 3000 or 3 liter ml, we ingested water 1,500 ml. Food intake with food around 1100 ml, or metabolism or oxidation 300 ml. Fluid output through the kidney 1500. Insensible loss means the fluid loss through the skin around 800. Insensible loss through the lungs around 600, and gastrointestinal tract like purification 100 ml. So here showing how we keep the balance of the fluid intake and output in body to keep the total volume of water in the body in balance, and body used the mechanism that adjusts the fluid intake as well as urine output. Body fluid intake and output, some notes. Large quantity of water are secreted into gastrointestinal tract, but almost all this fluid is reabsorbed. A large volume of electrolyte containing liquid moves into the gastrointestinal tract and then return again into extracellular fluid. Severe diarrhea results in loss of large quantity of fluid and electrolytes. The kidney play a major role in regulating fluid and electrolyte balance. The normal kidney can adjust the amount of water, electrolyte leaving the body. The quantity of fluid excreted by the kidney is determined the amount of water ingested and the amount of water, amount of waste and solute excreted. What are the mechanisms of the fluid and electrolyte balance, or what are the mechanisms of homeostasis? So homeostasis is the term that indicates relative stability of the internal environment. Concentration and composition of the body fluid must be nearly constant and helps to maintain homeostasis. When one of the substances in a kind is the deficit, either fluid or electrolyte, the substance must be replaced normally by the intake of food and water or by therapy such as intravenous solution and medication. When the client has excreted the fluid, an electrolyte therapy is directed towards the assigning the body with eliminate the excrete, maintaining fluid and electrolyte balance. Here, the kidney play a major role in controlling the balance of fluid and electrolyte. Another gland is called adrenal glands. Adrenal glands just top of the kidney. Adrenal glands also play an important role to maintain fluid and electrolyte balance by secretion of aldosterone. So aldosterone is a big player. Also aid with controlling extracellular volume by regulating the amount of sodium reabsorbed by the kidney. Antidiuretic hormones from pituitary glands regulate the osmotic pressure of extracellular fluid by regulating the amount of water reabsorbed by the kidney. So this is the three mechanisms of action, how it is maintained. Here, bit information about the fluid volume deficit. Fluid volume deficit means hydration occurs when the body fluid intake is not sufficient to meet the body's fluid needs. The goal of treatment is to restore fluid volume, replace electrolyte as needed, and eliminate the cause of the fluid volume deficit. So when fluid volume deficit, patient present with tachycardia, tachypnea, hypotension, fluid loss, less fluid, less blood volume, less blood pressure, and weak pulse. Patient easily fatigue, weakness, easily get thirsty, dry mucous membrane, GI upset, oliguria, or decrease the skin turgor. It is very common sign. What are the causes of fluid volume deficit? Maybe dehydration because of inadequate food intake or excessive loss of fluid. Hypertonic dehydration, condition that increase the fluid loss. Or hypotonic dehydration means chronic illness, excessive fluid replacement, kidney disease, or chronic malnutrition. Now, data collection. Easily get thirsty, poor skin turgor, or body weight loss, flat neck, dizziness or weakness, decrease the urine volume, increase specific gravity of urine, confusion, and increase hematocrit level. As I told you, most common symptom, tachycardia, tachypnea, hypotension, weak pulse, fatigue, weakness, and thirsty, and dehydration sign. So what are the interaction or intervention? The cause of the fluid volume deficit is treated. So underlying cause should be find it out. Fluid are replaced So administration of intravenous solution as prescribed. Monitor vital sign, admin oxygen, check the mucous membrane, monitor body weight daily. Provide fluid replacement, important. Import output, maintain. Test the urine for specific gravity and monitor hematocrit and electrolyte level. Prepare to correct electrolyte imbalance if need. Otherwise, it leads to cardiac dysrhythmia, which lead to cardiac arrest. Also, we assist the patient for ambulation because patient chance to prevent fall and fall prevention is the most priorities. So fluid volume exceed, if happen, what will be? Fluid intake or retention exceed the body's fluid needs. Overload. Usually patient present is like as fluid volume deficit, fluid volume excess or overload. Patient also develop tachycardia, tachypnea, but hypertension, bounding pulse, weight gain, or edema or jugular vein distended. Also called overhydration, fluid overload, circulatory overload. The goal of the treatment are restore fluid balance, correct electrolyte imbalance. If present, eliminate or control underlying cause of overload. What is the underlying cause? Maybe cardiac failure, renal problem. What are the signs symptoms? Patient develop cough, dyspnea, lungs pressures, increased respiration and heart rate, increased blood pressure because fluid is going up, blood volume go up, blood pressure will go up. Pitching edema, weight gain, neck and hand vein distension, increased urine output, patient get confusion, decreased hematocrit level. So what are the causes? Maybe overhydration, inadequately controlled IV therapy, kidney disease, long-term corticosteroid therapy, excessive sodium ingestion or injection, rapid infusion, or excessive sodium bicarbonate therapy, early kidney disease, heart failure, syndrome of inappropriate antidiuretic hormone, inadequate control IV therapy, replacement of isotonic fluid. What are the intervention? What are the nursing care? Monitor vital sign. Position the client semi-polar because of dyspnea. Admin oxygen. Check for edema. Monitor intake output. Monitor daily body weight. And restrict the fluid and sodium as ordered. Monitor hematocrit and electrolyte level. Restrict fluid as prescribed and provide a low sodium diet as prescribed. Oxygen and diuretics is very important for the patient. A client with kidney damage or failure is at the high risk for fluid volume overload.